Hello, my beautiful Lady Gardens, and welcome back to High Tea with Lady B, where we spill the tea on all things womanhood, the weird, the wonderful, and the widely under-discussed. Now, let's face it, after kids, most of us have peed a little, or a lot, when sneezing, laughing, jumping on a trampoline, or even just looking at a skipping rope the wrong way. Gosh, I remember being 8 weeks postpartum and booking myself into a mini tramp class at my local gym. I know, what the fuck was I thinking? Safe to say, that class was an epic fail on many accounts. And ladies, some of us pee a little, and some of us have graduated to full-blown incontinence, but you're not alone. Did you know that 1 in 3 women will experience urinary incontinence after menopause, and approximately 1 in 7 will also deal with fecal incontinence? Yep, it's a slippery slope, and one big contributing factor is the down-regulation of estrogen during perimenopause and menopause. Frickin' ovaries, they keep on giving. There are a few types of urinary incontinence to be aware of. You've got urge, which is the sudden gotta-go moment and not making it. There is stress incontinence, which means you leak a little bit when you sneeze, laugh, cough, or move, or do a mini tramp class. You have mixed, which is a chaotic combo of the above two. And there is overflow incontinence, where the bladder doesn't empty properly and leaks out. Add to that a cocktail of possible causes. You've got childbirth, prolapse, menopause, perimenopause, surgery, smoking, constipation, diabetes, and well, you get the gist. It's common and it is frustrating. But ladies, it is treatable. There is Botox. Yep, Botox has many uses. There are medications, exercises, and surgeries, and there are some other non-invasive treatments. Today, we are diving into one of those treatments. I'm joined by the absolutely brilliant Agnes from Zebra Aesthetics, one of my favorite nurses and a powerhouse of knowledge. She has over a decade of hands-on experience across emergency, mental health, neurovascular, pediatrics, medical, and aesthetics. Agnes has pretty much seen it all. Today, she shares her own vulnerable journey with post-baby urinary incontinence and introduces us to the Tesla chair, a game-changing, non-invasive option for restoring pelvic floor strength. Think Kegels on steroids minus the I don't know what the F I'm doing right now. But before we start, I just have an important note. We had a few tech gremlins during the Zoom recording, so the audio isn't perfect, but the rawness, the honesty, it's gold. And the conversation is worth every glitch. So we decided not to re-record because you just can't fake that kind of realness. Grab your cup of tea or maybe a shot of vodka. Do your Kegels while listening if you still have any feeling down there or know what the F you're doing, and enjoy this episode. Just don't freaking pee yourself. Let's get into it.
So, Tesla chair, is it Tesla? Is it part of the Tesla gang? No.
Elon Musk brought out his car years after the Tesla chair had been out.
Okay, so the car came out after. That would have been interesting. Maybe Tesla should look at importing these into their cars. They might get better sales.
Putting them into their car seats. Imagine having that.
I know. Look, you could actually be doing your Kegels at the stoplight.
Exactly.
Yeah.
You probably just have to press a button on the steering wheel when you come to a stop, and then you have it works, and then you release and keep going.
This is the perfect women's car. We need to start designing cars. I don't think there's enough women out there designing cars.
No,
Yeah.
I don't think there is.
And considering we are 85% of household consumers or people that consume are women, so we'll go to Tesla. We have the perfect female car for you. And they'll be like, right, we're joining forces.
What do we do? What do we need to do to make it work?
Yeah. So Agnes, thank you so much for joining us on the podcast. I know you've been using the Tesla chair in clinic for a little while now. I'm so excited to actually be going and visiting the Tesla head office and trying it out. But I really wanted to know, you're using it in your clinic. I'm assuming you've used it. I want to know what you're seeing in clinic. You can go to the head office, they can tell you all this stuff, and everyone's done their clinical research, but really it comes down to what you're actually seeing and what changes you're seeing professionally and potentially personally.
Yeah. So, I mean, I will start with myself. I personally had some really good results for myself. I had 2 children, all vaginal births. And
hats off to the vaginal births. They're great, aren't they? The gift that keeps on giving.
Oh, yeah, it is the gift that keeps on giving. And I tell you, when you have that episiotomy and you have those stitches, I know. And do you know,
I just learned that there is one of our pleasure neural pathways that runs through that area and where we get the episiotomy. And so they actually cut the nerves and one of the pleasure pathways to climax. There you go.
I guess that's why, when you think about it, though, now we're going a little bit off topic, aren't we?
Yes, we are, but that's okay. That's what we do here.
When you think about it, after you've had a baby, you literally feel nothing.
You don't, do you? Yeah.
Excitement.
Yeah.
And if they're saying
so
that
true.
Clearing some of those nerves when you have an episiotomy, it makes perfect sense. Because I tell you what, I did not even think of sex for the longest time. But it's the same as when you're breastfeeding.
Yeah.
And then you don't associate your boobs with sexually when you're breastfeeding.
No, you're like, oh, here they are. And you just get them out anywhere. You're like, okay, whatever. People are coming in. Like, my poor father-in-law would walk in. He's like, yeah, okay. And I'd be like, oh, I don't care anymore. I'm tired. And you're like, whatever.
It actually makes sense because I actually didn't even know that. So I've learned something new. And when next I'm talking to women, it's something that I can actually say, you probably have had those nerve endings damaged from having the baby. And it might take time for it to heal.
Yeah.
Actually, we do get it back.
Yeah.
It does take time, isn't it?
Yeah, because I think nerves take about a year, depending, generally, but from prior research, I know we're both nurses, we're not doctors to fully say on everything, but I think they take about a year to grow back. I know when I've had nerve damage before, they've said, look, it's really a full year, and then nerves tend to start acting the same way. But I suppose when you are cut down there, when they're sewing you back up, I don't know they're looking at the nerve so much as opposed to just the tissue. It's something to think about, and especially with this device, I dare say that it would help renew that area, not just in terms of incontinence, but in other things as well.
Yeah, so like I was saying, personally, after having my kids, over the years, I started noticing issues, especially with toileting. For me, it was mainly toileting.
Yeah.
I went from sleeping through the night to waking up twice a night.
That is me.
Midnight.
Yeah.
And I'm going, come on, it's only 8 hours. I used to be able to hold it through the night. Why is this not happening? And initially, I actually experienced a different device, which is not the Tesla, where it worked on the pelvic floor. And I went and had treatments done. When you go to conferencing, you get to give it a go.
Yeah.
And didn't even click in my head. And then I started having treatments with the Tesla. And I remember being, after about 5 or 6 sessions, it was, how are you finding the chair? And I was like, when you live busy lives, it didn't click in my head until I sat down. I was like, hang on a second, has the chair really worked? Then it dawned on me, I wasn't waking up at night to go to the toilet.
How good's that? After you have kids, right, everything changes down there. You're like, fuck, I don't know what's going on down there now. It's a whole new normal. And then you get used to that normal. You don't even realize you're waking up at night all the time. Like, you just go, oh yeah, because you've done that when they're babies, right? So you get up, you'd feed, you'd go to the toilet, whatever. And it's not until they get a bit older that you go, oh God, I'm waking up to go again, especially if you have a cup of tea before bed or something. And until you get asked the question, you don't even think about it.
Realize it.
Yeah. Or you're like, I'm tired because I keep waking up.
Yeah. So I found it actually really helped me in that regards. And I do a lot of driving when I go and do training. So I'm driving 3.5, 4 hours, sometimes 5 hours on the road. And I was having to stop every hour and a half. It was like, the moment you get in the car, you always After an hour, you're like, oh shit, I got.
And then you're just literally busting. You're like, I am literally going to pee myself. Yep.
Yeah. And we have a thing in my family where if I get in the driveway, even my children now, when I park the car in the garage, they just open the door and stand aside because I'm bolting.
You're bolting. That sounds like me. I'm like doing the same thing. And I'm like, oh my God, everybody get out of the way. If you're at the service station, the kids, and they're busting, you're like, they start, you're like, get out of the toilet. I'm getting in. I need to go now, right now.
But I found that it's actually really helped me. And we start looking at that perimenopausal phase where you're now starting to lose sleep as well. I was struggling because I'm waking up to go to the toilet, and then by the time I try and fall asleep again, I'm waking up to go to the toilet. So I was sleep deprived. I was frequenting to the toilet. It was just becoming a shit show.
Yeah.
And after using the Tesla for about 6 or 7 times, I'm just sitting there going, this is working. So at least once or twice a week, I sit there and I literally just have a session. I don't wake up at night anymore. It's also my quiet time. I have my clique home. So when the kids are home and they're fighting or it's been a big day, I just go and sit on the chair and have that quiet moment.
I love that.
20, 25 minutes in the chair and I've had my session.
Yeah.
The best part, what people don't realize, is one of the things I love to tell people is one session of your Tesla session of your pelvic floor exercise or strengthening is equivalent to 50,000 Kegel exercises.
Oh, wow.
30 minutes. I mean, who can say in their lifetime they've done 50,000 Kegel exercises?
I know. And you never know if you're doing them right too. Like, you're like, am I doing this right or am I not doing this right?
Exactly. And sometimes, especially when you don't know if you're doing it right, it almost sort of helps you bring you back to that stage where you're like, oh, I am now doing it right. So even if you've done your sessions and you think, oh, you know, I can go for a few weeks without going, you now have that concept of how to engage your Kegels and how to let go. Because half the time people are not even doing it right. So it helps with that. It's strengthening that area, and it also helps with improving the sensation. Like when we start talking about those sensations that we lose over time, it helps with that overall vaginal health in that area too, which is amazing. And we know studies have shown that it also helps with lymphatic drainage. It's blood circulation.
Yeah.
And we know when it's starting to go dry, we're not just talking post-children, we're also talking perimenopausal women, menopausal women as well, because we start getting that dryness in that area. We're talking incontinence, as in like urinary incontinence, but it also helps with fecal incontinence.
Wow. Because you wouldn't even know how to train that, right? And when we were at that conference, I remember one of the presenters saying that I think it was like 1 in 7 or 1 in 10 will get fecal incontinence. I was blown away with that number. I was like, holy Jesus. I just did not even think that, one, it was really a common thing, and secondly, that I could get that. It wasn't women that have just had urinary incontinence and that's bad. They're like, it develops into these other things.
Yeah, I know. I mean, when you think about it, that whole area is all connected, right? Yeah. I remember earlier in my nursing career, I have helped with delivering babies. And when most women, when we push, what else comes out?
Yeah, exactly. What else are you pushing there? I know you're literally like, I don't even know what's going on down there. I remember my obstetrician was like, here, have a mirror. I'm like, I don't want to see it. I don't need to see this. But you are pushing so hard, and that's a lot of pressure on that internal space down there.
100%.
Yeah.
And also you have people, women and men, that also struggle with issues with prolapses, right? It's something that can help strengthen the muscles in that area, because when your muscles are weakened, your bladder's just going to drop.
Yeah. Yeah. And it gets aggravated. Sometimes not even the bladder, it's just the pressure of another organ sitting near the bladder, or the bowel sitting near the bladder, that actually makes it become overactive because it's getting pressure put on it.
100%. Yeah. 100%. So I love the Tesla, and another one of the benefits it has is it helps with pain. Got pinched nerves in my back, and I'm going to sound like I'm so accident prone. I am not. None of them were my fault. I have been 3 car accidents. And
were you driving a lot?
And from that severe whiplash, my back is it's pretty much fucked. And I remember going to see a physio, and my physio going, you need to work on strengthening your back, you need to do deadlifts. I'm going, how the fuck am I going to do
deadlift? Yeah.
When my back is so weak, and he's going, well, that's what's going to help with strengthening your muscles. So when we're talking about the Tesla strengthening, that functional magnetic stimulation, what it does is stimulating the muscles around your spine, strengthening, because what's causing that weakness is your spine. It needs your muscles around the spine to be able to hold this and give it that support. So the Tesla helps with strengthening those muscles, so then it can give the support to your spine as well, which is fantastic.
Yeah.
When I do my pelvic floor, you've got the advantage of having both your pelvic floor and your lower back treated at the same time in that 30-minute session.
Yeah, okay.
So you just prepare because it alternates. And I often, when people sit on the chair, they often go, oh, that's a weird sensation. It's actually a weird. Did you sit on it when you
I couldn't, because I had a pair of jeans on, and they said you can't have the jeans with the zipper. They were just worried about the zipper getting too hot. Was that right? Yeah.
With metal, yeah. So it is quite a weird sensation. And I tried to say to one lady once, it's like, oh, it's almost like having a vibrator. And I was like, well, maybe not everyone is used to vibrator. Not like having a vibrator.
And then they're all just sitting there out in the open. This is at the conference, not when you actually get a treatment done. And, it's like, I wonder what's going on now.
I know. But it's not even like using a vibrator at all.
Yeah.
Can't even describe it, but the sensation, after a few minutes, people actually like the sensation. It's actually kind of relaxing.
Yeah.
You just sit there, and I've got a TV in my clinic, so people sit there with the TV on, and then you can just flick through some channels. Often I tell people not to have their phone because of the magnetic waves. I don't want your phone to get fried because you were sitting on the chair, so you can at least use the remote control and watch the TV. Or I can just chat with you. We can have a chat. We can be talking about other things while they're sitting in the chair. And I'm finding some men, especially if I have a patient who comes to their husband, and the husband tends to have a little bit of lower back pain, I get them to sit in the chair and go, just give it a go. Tell me what you think. And often they actually come back and they go, my husband said he really liked it. He slept well last night. And even after that one session, people can actually have that relief and they sleep well at night. For example, I have a couple of patients that have issues with pain in their actual pelvic region.
Yep.
And when we do the lower back and the pelvic floor, it's like it's helping with that strengthening, but also with that lymphatic drainage. It's helping with releasing the tension in that area. And often they come back and they go, I slept so peacefully last night. I always find men are very skeptical about a lot of things. I'm sure if you try to convince your husband to do something, you'd be like,
yeah, as if that's going to work.
Exactly. I've got 3 brothers, and 2 of my brothers have served in the defense, and one of them, he has a lot of back injuries, and I'm talking massive injuries, had surgery and stuff. And I said to him one day, just indulge me.
You want to test it?
Exactly. I said to him, I could be biased thinking, oh, this thing works, but I wanted to be on somebody who comes in with no expectations.
And already a bit of a bias. A bit of like, oh, yeah, like that's going to work.
Exactly. So he came in and sat on it, listening to his music, sat on it, and I didn't think anything of it because he does not sleep well at night because of his back. Came back the following morning, goes, what kind of witchcraft did you do on me? I'm like, what are you talking about? He goes, last night, I slept so well for the first time in such a long time.
Wow.
Like, what do you mean? He goes, I don't know what that chair does, but...
He's like, I'm getting one.
I know, but he actually said to me, you need to show me how to use it, because when I'm not in clinic and I'm traveling, he can use it. I was like, okay, so I've shown him. And the number of times that he just sits in there, and he also gets my mom to sit in there and she gets a session as well. So they're both getting some relief out of it. But he actually now swears by the chair.
That's amazing.
Like, that chair works. And this is a person that I can't convince to do half of the things, because he's like, yeah, right, as if it would work. Nah, that's not going to work. Nah, I don't believe in that. He's constantly telling me he doesn't believe in a lot of things. And that to me is testimony that the chair works.
Yeah, definitely.
Yeah, I have one lady, she came in and she said, Agnes, I've had back pain for 15 years. I've tried physio, I've tried chiros, and your ad popped up on my Facebook one day, and I thought, no, what have I got to lose? Let me try. I said, okay, I recommend a minimum of 10 sessions to my patients just for them to see results.
Yep.
And I say, 2 to 3 sessions a week. So majority of them, I said, because I know you lead busy lives, try and come in twice a week so we can do those sessions for you. So she came in. Initially, she was like, oh, do I have to do 10 sessions? I said, yeah. So I ended up creating a 5-session package for her. I said, yeah, I'll just do 5 sessions for you. She came to the 4th session and she said, I'm going to do the 10. And I said, why? She goes, I've been sleeping better.
Wow.
Mom. And I said, well, like, you're not just saying. She goes, no, I have not slept this good in years. Even my wife has actually said I am not fidgeting at night. I'm literally like sleeping peacefully because I'm actually comfortable. And another advantage here, because what I was also doing for her was, we know your lower back is connected to your core. So obviously when you're strengthening your lower back, you want to strengthen your core. And the Tesla chair has the Tesla former, which comes with these pedals that you can attach to the abdominal area so that you can actually strengthen the core as well. When she sits in the chair, she's having a pelvic floor, her lower back, and her core worked on at the same time.
That's incredible.
I know. And then she said to me after, I think we were in about session 7, she said, does this thing help you lose weight? And I said, what are you talking here?
You're like, I hope so. I'm going to be on it every day now. No, not.
I do. Well, I try not to oversell things to people.
Yeah.
And you're coming in, we know the Tesla former helps with body sculpting, burning of fat and stuff like that. And I said to her, I didn't want to give that illusion that you're going to burn fat when you're sitting in the chair, because what if you don't see it?
Yeah.
She goes, I've literally dropped a dress size. So what do you mean? She goes, my pants don't fit. I'm actually fitting in my pants that I used to wear like before I put on weight. So I've dropped a dress size and pant size. For her, that was an added advantage.
Because you're working the muscles, right? You're working those tiny little muscles that we can't work. If you went and did deadlifts, you're actually working on these major muscles, but you're working all those tiny, tiny little muscles and creating impulses. It makes sense.
Yeah, 100%. And she was so stoked. Unfortunately for her, when we got to session 8, she was at work and she done her back and she's messaged me, can't come in, I've done my back. I said, all right, you need to do everything to actually rest your back before we start doing your sessions again.
Yeah.
Because I don't want to aggravate anything. I want you to actually get to that stage where, because she couldn't even walk when she's done it.
Yeah.
And so she finally came back, and she actually finally came back last week. First thing she did when she walked in, she goes, Agnes, I cannot wait to sleep well tonight.
Oh.
And I was like, what do you mean? She goes, I swear to God, this chair, I sleep well after every session. And the following morning, she's like, oh my God, the best sleep I've had since I've done my back again. It is so good. See you next time. And that's how excited she was about the chair. I get people with really good results that come back and they're like, this thing works and we need more of these chairs. I'm like, yeah, I know. It is good technology that works, and it works for everyone, like even men, not just lower back, but men that have had prostatectomies because they lose that strength in their pelvic floor. They're constantly frequenting to the toilets. They can have those treatments as well because they need that strengthening.
Yeah, and that's a common thing for men as well. They tend to have to go to the toilet more often as they get older with prostate issues and whatever. Obviously, I don't know a whole lot about that, but it's great that it's beneficial for not only women, but for men as well. I know we mentioned it before, but post-pregnancy, wouldn't this be great in terms of what we should be giving these as push presents, really, to help with your pelvic floor straight away, as opposed to waiting for there to be a problem? Because there's always going to be, even if you go, I'm not going to the toilet, you've still changed regardless. You've had a 7, 8, 9 pound baby sitting in your uterus. There's going to be changes. So post-pregnancy, it seems like we should be doing something to support women so it doesn't get worse.
100%. If you're going to be baby showers, man. If I was to have a baby now, knowing what I know now, I'll be telling everyone, just buy me a package for the Tesla chair as my baby shower present, my push present, because you can actually start having treatments from 6 weeks postpartum as long as you have been cleared by your obstetrician. So anyone can start those sessions 6 weeks postpartum.
Oh.
If you want to sit in the chair and breastfeed your baby.
Still do it. Yeah, bring your baby in. There's so many treatments you can't go to when you have a newborn and you're like, oh, I can't like actually go anywhere because you've got a newborn with you. Whereas the fact that you can just go and get this done. And it's really good to also let people know, because I know that a lot of people used to think, like especially with HIFU and things, that it would be an insert, whereas this isn't inserted. You're actually just sitting in a chair.
You're just sitting in this ugly looking chair. What? You don't even have to take your clothes off.
Yeah.
You just sit there. And that's the best part about it, because the magnetic stimulation actually penetrates up to 10 centimeters. So it doesn't matter how big the clothes are, it's still going to get into that area and help with that strengthening.
That is awesome, because I think that's one thing that people, they see these devices and they think that there's something to be inserted, and this is completely non-invasive. I am so excited to try this.
You will literally enjoy it. I really like it. I have a lady who has been having her glutes done. She wanted to
Love that.
like, I need that perfect peach, Agnes. So she comes, she lies on the bed, I attach the pedals to her glutes, and we're working on her glutes.
Perfect. You're like, just going to work on everything. I've got pelvic congestive syndrome. I'm wondering if this will actually help with the veins. So basically it's when the veins after childbirth have stretched and they don't go all the way back, because everything's working on a flow system through your body, and it's like a backflow from your heart, and then it pushes everything back, and you've got valves, and the vein stretches too much, you get backflow and it pulls in the pelvis. Maybe something like this would actually help that.
Since you're going to head office, I think that'll be a really good question to actually ask.
Yeah.
I haven't come across any patients that have got that diagnosis, so I haven't had to deal personally with the patient with that, but it would definitely be a good question to ask. However, I know for a fact that if you have some patients that have, because obviously we know with having the baby, it stretches your abdominal wall.
Yes.
People who have had
I have that.
Yep. It actually can help, because when you're told you need to do some ab sessions, you need to strengthen your core so that your
But it
muscles
still
come
pulls
back.
it apart when you're strengthening your core, and
It actually helps with helping strengthen your core muscles so they can
come back together.
Yeah. See, for me, after my second child, I could pretty much fit my whole hands through.
Yeah, I was the same.
The muscle separation was. And with all the amount of exercises that I did, I got to a stage where I was still being able to fit too.
Yeah, I'd wear the pants, I had the wrap, I had like a hip thing, I had everything you could possibly have, and did all the exercises.
Yeah. But I was like, no, I want to see if this works. And I'll just attach it to my belly like there and tell you, you not, I cannot fit my finger through.
Oh, that would be amazing. I need that to happen in my pelvic area.
Yeah.
Because my separation comes down so quite low.
Yeah. Yeah, it is really, really good, because the thing is, you can attach 2 pedals, or you can attach 1 pedal, depending on how wide your abdominal area is.
Yeah.
But it really does work, and it can actually bring those muscles back for you. So even with postpartum, obviously, as long as you have been cleared by your obstetrician, we can start having those treatments for postpartum treatments as well.
Yeah.
For your abdominal muscles as well.
Oh, that is incredible. I'm looking forward to this, because I was so worried about having to get the surgery. I'm like, oh, it's just 6 or 7 weeks of absolute pain. People that have had it done and said it's torturous. It's great afterwards, but that 6 weeks is pretty painful. Have you had any clients that you felt it didn't work on, or was that more related to the fact that they got 1 session and they felt it didn't work, but really you can't go to the gym once and expect you to have muscles?
Yeah, I have had feedback on people who have said, oh, it didn't work. And majority of them are the ones that literally just go, oh, but I just want to do 1 session.
Yeah.
And I mean, you can't force a person to go and do the whole 10 sessions, whatever, because that's up to them. But like I always say to them, well, do you go to the gym and expect to walk out looking like Arnie? No, you don't.
Yeah. And it's a muscle workout. That is what it's doing. You're trying to strengthen the muscles. The muscles aren't going to strengthen in 1 session. They'll get stronger, but you need to obviously do it more than once.
And even after those 10 sessions as well, one of the things I say to people is you will still need to do maintenance. I'm not saying come back every week, but you could come in even a couple of times a month to maintain that, because like anything, like going to the gym, you still want to continue strengthening that muscle. If you stop working it, then you're going to lose the strength in it, and you're going to start having issues again. Some people will go also, how long can I go for? I said, well, You can choose to do this for the rest of your life, or you can choose to do this until you go, you know what, I'm just happy with the dribbling and the feezing and the incontinence issues that come with it. As we know, we've got different types of incontinence. We've got your stress incontinence, you've got your urge, you've got different types. We can also treat that because it comes with the different functions that you can treat different conditions.
Different conditions. Yeah. And explain, what is stress incontinence? Is that when you put it under load if you're jumping on a trampoline?
My understanding of it is it's almost like that when there's that strain on you and you're putting
it under stress. Yeah.
Yeah.
Okay. I thought I'd just clear that up. I was a bit confused about it.
Yeah. And then you have those people that just always have the urge to go. Yeah. There is a function for that as well.
Oh, I'm so excited to try this. This is incredible.
Another thing as well I was going to say is sometimes when you've had kids, sometimes some people will have issues with hemorrhoids. It has a hemorrhoids function.
Stop it. A hemorrhoids function.
I know.
Oh, it's not to go to the doctor about your hemorrhoids. That would be sensational. I think that's worse than going to your gynecologist, personally. So we'll just come and see you. Agnes, treat the hemorrhoid.
It is embarrassing sometimes to actually talk about hemorrhoids. But we know it's a thing that happens, but it actually doesn't have that function. I have a friend who has issues and she's had a session, but then because we're both busy, so I'm actually keen on giving her trials just to see how she goes, because I wanted to be able to tell me if she got good results from
it. Because you essentially want to do your own clinical trials when you have these products in. Like, I know when I got my HIFU in, I want to trial it first before I'm actually saying to people, this is what it does. Because you always get the clinics or the people selling it, the companies saying, oh, it's going to do this, it's going to do that. And you're like, yeah, will it? And then when you actually trial it yourself and see it on your clients or yourself, you're like, wow, there is a real difference here.
100%. Oh, I like the fact that it actually helps with so many things. You have physiotherapists that have them in their clinics, so they can actually use it for different things as well.
That's incredible. We're talking back pain, we're talking urinary incontinence, we're talking hemorrhoids, we're talking fecal incontinence, a whole array of things. It's this workout for your pelvis and your lower back.
100%. The best part is it's one of the best treatments that you can ever get a friend, a mother, a partner, a wife, as a session for them to feel confident in their own body, because we know no one wants to be seen walked into a chemist buying incontinence aids, because especially when they're quite young as well. Yeah. I had someone message me asking what is the best incontinent aid to use, and they were in their early 50s, and I said, you need to find someone with a Tesla chair area. Go and have the sessions before you start using incontinence aids and see if this works for you. Imagine being in your 50s and you're already starting to think of that, and all due to stress incontinence.
A lot of women postpartum will have major issues as well, and it's one of those things to say, like, people go, oh, it's just normal, you're getting older or you've had a baby or whatever, but it's not normal. You can fix this and you don't want it to get worse. And I think that's to anyone who has got incontinence or feeling stress incontinence, whatever it may be. You don't have to live with it, and it's not normal just because your doctor says, oh, you had kids and that's just normal. Not normal. There are so many things. Eventually you may need to go down a surgical route. That might be something you need to look at, depending, but it's that message of it's not normal and there's things that you can do to fix it.
100%.
Agnes, thank you so much for sharing all of your knowledge. This was fantastic. We could talk all day about incontinence and our experiences.
Yes, and we could talk all day. Thanks for having me, Kate. It's been amazing. Thank you for having me on this chat.
Until next time, my beautiful vaginas, water those lady gardens because they are worth it. Please note that this podcast is for entertainment purposes and informational purposes only. The content shared is not intended as medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider for any medical concerns or before making any health-related decisions. The views and opinions expressed on this podcast are those of the host and guests, and it does not represent those of any medical organisation or institution.